Tinnitus is the name for hearing noises that do not come from an outside source. It's not usually a sign of anything serious and may get better by itself. Check if you have tinnitus. Tinnitus can sound like ringing, buzzing, whooshing, humming, hissing, throbbing, music or singing. You may hear these sounds in one or both ears, or in your head. They may come and go, or you might hear them all the time. Causes of tinnitus. It's not always clear what causes tinnitus, but it's often linked to some form of hearing loss, Meniere's disease, conditions such as diabetes, thyroid disorders or multiple sclerosis, anxiety or depression, taking certain medicines. Tinnitus can be a side effect of some chemotherapy medicines. Antibiotics, nonsteroidal anti-inflammatory drugs, NSAIDs, and aspirin. Non-urgent advice: see a GP if you have tinnitus regularly or constantly. Your tinnitus is getting worse. Your tinnitus is bothering you. For example, it's affecting your sleep or concentration, or is making you feel anxious and depressed. You have tinnitus that beats in time with your pulse. What happens at your appointment? The GP will look in your ears to see if your tinnitus is caused by something they can treat, like an ear infection or a buildup of earwax. They might also check for any hearing loss. You may be referred to a specialist for further tests and treatment. Go to AE or call 999 if you have tinnitus after a head injury. You have tinnitus with sudden hearing loss, weakness in the muscles of your face, or a spinning sensation, vertigo. Things you can try to help cope with tinnitus. Try to relax. Deep breathing or yoga may help. Try to find ways to improve your sleep, such as sticking to a bedtime routine or cutting down on caffeine. Try to avoid things that can make tinnitus worse, such as stress or loud background noises. Join a support group. Talking to other people with tinnitus may help you cope. Do not have total silence. Listening to soft music or sounds, called sound therapy, may distract you from the tinnitus. Do not focus on it, as this can make it worse. Hobbies and activities may take your mind off it. Treatments for tinnitus. If the cause of your tinnitus is unknown or cannot be treated, your GP or specialist may refer you for a type of talking therapy. This could be tinnitus counseling, to help you learn about your tinnitus and find ways of coping with it. Cognitive behavioral therapy, CBT, to change the way you think about your tinnitus and reduce anxiety. Tinnitus retraining therapy, using sound therapy to retrain your brain to tune out and be less aware of the tinnitus. Tinnitus retraining therapy may be available on the NHS for people with severe or persistent tinnitus. It's unclear if tinnitus retraining therapy works for everyone. It's widely available privately. If tinnitus is causing you hearing loss, hearing aids may be recommended.